We have access to vast amounts of data, but making sense of data and leveraging it to make more informed decisions can be difficult. Created to meet this growing need, the Curtin Institute for Data Science applies data analytics, computational modelling and visualisation to our greatest challenges.
The Institute is a knowledge accelerator that brings together over 200 researchers across all 4 faculties at the university: science and engineering, humanities, health sciences and business and law. Those researchers tackle problems that are both fundamental in nature as well as industry focused. Our researchers have access to internal and external state-of-the-art facilities such as the Pawsey Supercomputing Centre, which houses one of the largest supercomputers in the Southern Hemisphere, the National Computational Infrastructure, and various cloud-based services. Staff at the Institute work to enhance the uptake of data science across Western Australia.
Researchers are working on a variety of projects. These include building a global open knowledge database, helping planetary scientists detect faint meteor trails, and harnessing machine learning to better manage sustainable aquaculture.
The fisheries and aquaculture industries are worth $3 billion a year to the Australian economy. The primary indicator of marine ecosystem health is fish abundance, biomass and biodiversity. Current methods of counting and measuring fish are a manual and labour-intensive process. This limits the amount of data that can be analysed. We're developing machine learning algorithms that can speed up this process by automating much of the manual work, potentially accelerating government policy development around climate change, habitat monitoring and managing fish stocks.
The power of computation is also being used to better understand a disease that is far more deadly than many of us realise.
In Australia, chronic kidney disease, or CKD, contributes to more deaths annually than breast cancer, prostate cancer and road accidents combined. Indigenous Australians are 4 times as likely to die from CKD as non-Indigenous Australians. CKD often has no symptoms in its early stages, meaning up to 90% of cases go undiagnosed until the disease is too advanced to manage, which inevitably leads to death. The cost of treatment of advanced stage CKD is high and currently unsustainable by Australia's public health system. We are using a big linked data approach to help understand the burden of CKD in WA and to identify groups that are at risk of developing the disease. This will help us to establish paths of early intervention, leading to better outcomes for patients and creating a sustainable and equitable healthcare model.
By fostering collaborative research and problem solving, the Curtin Institute for Data Science is taking industry into the future.